My feeling when I designed this was that it would be good for people to come together and have these conversations, but of course you don't know until you actually get there. And one of the wonderful things about attending these events was the level of enthusiasm about having the opportunity to talk about this. And I think part of that is because we don't get to talk about this much. If you're a person who has a family member who is living with a mental illness, or if you yourself are that person who is diagnosed with a mental illness, it's not something that you can easily take into conversation with people. So bringing together a group of people with whom you knew you could just say what this was like, you could share this openly, I think was great for people. Another thing that people responded to very enthusiastically was the opportunity to do that in a room that included both people who were diagnosed with mental illness and the people that cared about them. And they confirmed my impression that we don't do this very often. And I think that sometimes there's an apprehension about bringing people together like that. But overwhelmingly, the response seemed to be that people appreciated hearing those different perspectives. So I'm very pleased that that works so well, and I'm hoping that that will be one of the legacies of the project, that people bring people together to have these type of conversations more often.
Yes. I don't have any advice to give everybody, but I just wanted to say thank you to everybody that came today, because honestly, I learned a lot, even in my group and even in the little breaks, talking to people. I learned a lot about, I used to get very mad at my brother because I wouldn't, sorry. I didn't understand why he was it kind of felt like he gave up on himself, and we were we were trying to keep it going for him, and he wasn't, sorry, I'm so sorry. He wasn't pushing for himself, but I'm starting to understand that there is light at the end of the tunnel, and I used to think that as soon as he gets his medication, it's gonna be a quick fix. He's gonna be back to himself again. Everything's gonna be normal, but it's not. It's an infinite journey, as you said, and it's gonna go on forever. And all we can do is support them and not try to make them into what we want them to be. Because that's what I would always say. You're my big brother. Why don't you take care of me? But he needs us to take care of him. And I just want to thank everybody here for all the advice that you gave us, because we didn't know about half of these resources, and we're gonna go home. I'm gonna go home right away and Google them and try to help him. So thank you guys.
Well, thank you.
I just don't understand why it is that there is stigma against mental illness, because when you're mentally ill, it's the brain that's affected, which controls everything else. So that's one of the most important organs that we have in our body. So, and if that goes wrong, everything can go wrong, and in many variety of ways. And if what's the statistic, 1 in 4 or 1 in 5 end up with mental illness in their lifetime. So we're talking about everybody being affected, because if it's not you, it's someone you know. So, legislators beware, you could be next. And it's society as a whole that's going wrong. It's not because mental illness is on the rise as well. So, we've got to do something about society.
I was in a group with it was just men and me, and older men too.
Oh, that's right, yeah.
Yeah, so it was really interesting. I learned so much. I think I was the youngest one here, but I'm also very mature for my age. So I feel like I learned a lot. I learned about a lot of organizations that I never knew existed. I learned about a lot of connections. I've made a lot of connections today. I got some people's emails, so hopefully that maybe we can go somewhere. I just feel like it's important for people to talk about things, and like Robert said, the more he learned more from talking to people and communicating with other people that have gone through things than doctors and stuff. I feel like the best way to learn is just the native way is through storytelling. Mm-hmm. So just hearing other people's stories and sharing and being able to share your story in a a safe space is what this was, and I feel like that's very important, and I'm very glad that I was here to be a part of it.
It was a space where these four populations were in the room together and having really meaningful conversations. They felt like some myths that they had about people living with a mental illness was debunked. They felt like it was a space where they could ask questions, also stand up for their perspective and share perspectives with other people. In the feedback forms, there's even someone that described this experience as cathartic. People felt that this space was non-judgmental. People felt that this space was a safe space for them to share their experiences for the sake of helping other people. And I feel like that value, that community value of bringing people together, really encouraged everyone to feel like, you know what, I'm so happy I participated in a study like this. This meant so much to me because I feel like I'm helping someone who might be going through the same situation. And that experience is invaluable.
I think it was actually just nice to just hear other people's stories, their family members and their own personal mental health stuff and whatever. So I think any information that I receive that may relate to me and somehow is therapeutic and healing for me.
I always like the saying that everybody has a story. So when somebody's out of sorts, we shouldn't be so quick to judge. So, and in sharing that, I just, like, so many people are out there working every day and you really don't know what their backstory is, right? Yeah. So we should be a little more compassionate towards each other every day.
What I loved about this group was, listening to everybody else talk as well and reading your boards. We all have entirely different stories, but we all have almost exactly the same experiences. So it's so nice, and we talked before we started that we hear, oh, this is a judgment-free area. Oh, you can talk freely, but if you do, you're judged. And it's so important when everything else has made you tired right down to your soul that you can come to places like this and actually let your guard down. Actually not walk on those eggshells for a minute and just kind of go, I get why support groups work, because you do feel alone, you feel isolated. So thank you so much for everybody sharing, because it really helps everybody else understand that you can always pick up the phone or text or email or connect on Facebook and know that people do understand your story. And you're not just going to hear, you know what you should do, which I'm sure we all have. So thank you so much.
Thank you.
How wonderful it is to have the consultation with people that have experienced this. It is invaluable information to take with you and to push the right policies and the right help. And I think no matter how intelligent a person is at the top, if they don't go to the front lines and consult with doctors, nurses, caregivers, families, we're not going to get the holistic picture of what is needed and what the problems are and what the barriers are.
I think that we have to work on the stigma of it, and that we have to, if you imagine those of us, like for today, the cafe, those of us that found out about it were invited or were interviewed to come, were either people who suffered with that mental illness or people who are supporting it, and in my case, I'm both. Mm-hmm. And there was such passion and such innovation and so many ideas. We have collectively so much knowledge about the illness and what should be done and what could be done. And you feel really positive, like we can do something, we can make an impact. But unless we convince the people on the outside, those that don't have a direct connection, then it's very difficult for us to move forward. Financially, just like in support employees for government programs and basically just policymakers, like all of those people have to be involved in order for movement to take place.
There's about 15 people here, and we all can be advocates. And being advocates is reaching out and possibly joining groups, but speaking out, like, you know, for example, during election time, everybody says, speak to your politician, speak to your representative. Well, we are representatives and we can speak to other groups. And the whole concept there is to reach out so that it helps to reduce the stigma or raise the awareness, but it also creates a ripple effect of other people speaking and feeling comfortable in the community, realizing that mental health is just an illness. Speak to your neighbors, speak to your friends, become an advocate.
My hope is that the Family Cafe project and the other parts of this family caregiving project are going to be able to shift the way that people think about families. Actually, first of all, to even get them thinking about families that are living with a family member who's diagnosed with mental illness. So there's a piece of this that's just about awareness, just actually getting the message out there that there are people in our community who are having these kinds of experiences, and we can make our communities better places for them. And then I also expect to put this project in places where it can have an influence on training of health professionals so that they can bring new skills and new ways of thinking into the work that they do with families. And then there is a very deliberate plan to also package this up in ways that it reaches people who make decisions about where our health dollars go. So I would like to see different types of services available. I would like to see them put in places where they can reach families, and I see this project as having the potential to get that message to the people who make those types of decisions.
The more I talk about mental illness and the struggles that I face as someone who's had mental illness and a family member has faced, I think I feel better, and I think the word needs to get out there so that stigmatization is lessened. There's no other better way than hearing the stories of people who are affected by mental illness.
This project would not have been possible without funding through a research grant that came from the Social Sciences and Humanities Research Council of Canada. There was also funding that was available through the Factor-Inwentash Chair in Health and Mental Health, which is here at the University of Toronto. Of course, there are other types of support, space, resources, time, and the University of Toronto Factor-Inwentash Faculty of Social Work was very generous in supporting my work in this project through space and time and resource. In addition, the agencies in these communities that hosted us and also had their people work with us to make this project happen were an important support for this project. The various social work students that enthusiastically gave their time to this work were an important support. And of course, none of it is possible without people in our communities, these families that we spoke to, who step forward and say, I would like to be part of this, I would like to share what I know to help make this experience better for people like me.